And as I said, we're here to talk about reopening considerations for families of students with disabilities for the start of the new school year. Michigan Alliance for Families assists parents in understanding their special education rights and assists families in communicating their children's needs and finding information to help their children develop and learn and to understand their special education rights and protections. We offer resources and information about disability and special education issues involving children and young adults from birth through age 26. Michigan families are thinking about what the return to school will look like and how to plan for children to resume in-person learning. This presentation will hopefully give you some guidance and things to consider as you decide what returning to school in the fall will look like for your child. Executive Order 2020-142 requires districts to submit a preparedness and response plan to the state. Schools must submit their plan by August 15th or 7 days before the first day of school, laying out how they will cope with the COVID-19 pandemic across the various phases of the Michigan Safe Start Plan. Review your district's plan and formulate any questions that you may have. The Michigan Return to School Roadmap is for all students. District plans must include students 18 to 26. Options being offered to students in the school district must be offered to all students, including those with IEPs. Most of the state is in phase 4, in which in-person instruction is permitted with required safety protocols. Some parts of the state are in phase 5. Some districts have developed re-entry task forces. If your district is one of these, you may be able to participate and provide parent input into the return to school plan. A lot of districts have surveyed their parents to see what they want school to look like for their child, in-person, virtual, or a blend of these options. Based on the information you obtain from looking at your district's return to school plan, what are your thoughts and concerns about what school will look like for your child? Document your concerns to share with school personnel. New Center for Disease Control guidelines encourage cohorting, sometimes called podding. Cohorting is a new term for a strategy that schools may use to limit contact between students and staff as part of their efforts to limit transmission of the virus that causes COVID-19. These strategies work by keeping groups of students and sometimes staff together over the course of a predetermined period of time. Ideally, students and staff within a cohort will only have physical proximity to others in the same cohort. Each district developed a continuity of learning plan to finish out this past school year. This plan explains how the district provided instruction for all students, including those with IEPs. This could have been paper packet pickup, phone calls, online classes, or a combination of methods. For each student with an IEP, the state encourages IEP teams to create a contingency learning plan to explain the special education and related services the district is able to provide during the pandemic. This plan is individualized based on the current IEP and makes sure the student can access the education being offered by their district. Districts are encouraged to develop the plan with input from parents because parents are part of the IEP team. When schools are closed to in-person instruction, districts must strive in good faith to the extent practicable based upon available resources, technology, training, and curriculum, as well as circumstances presented by COVID-19 to provide equal access instruction to students with disabilities from birth through age 26. As the new school year begins, districts must figure out how to provide services to children and ensure that a free, appropriate public education, FAPE, is provided. There is no more good faith effort. Districts need to be proactive in their planning and begin collaborating with parents to develop contingency learning plans in order to support a fluid approach to education this year. When the IEP team determines in-person instruction is appropriate, the IEP would reflect the full offer of FAPE in a brick-and-mortar setting. Additionally, the IEP team should develop a contingency learning plan and identify triggers for implementing that plan only when the full offer of FAPE cannot be implemented. This means if the IEP team determines in-person instruction is most appropriate and a parent does not want to send their child to school, then the IEP team would implement the contingency learning plan. When the parent sends the student to in-person instruction, there is a seamless transition back to the school setting where the IEP can be fully implemented without further meetings. The contingency learning plan and the identified triggers should be reflected in the current offer of FAPE. Parents and schools must work together to figure out how to address their child's needs as the new school year starts. COVID-19 has not changed any rules or regulations regarding a free appropriate public education, least restrictive environment, individualized education programs, and procedural safeguards. In preparation for schools to reopen, protocols will be in place in the school building and classroom settings as set forth in the Return to School Roadmap developed by Governor Whitmer, the COVID-19 Task Force on Education, and Return to School Advisory Committee. There could be staggered schedules, certain days virtual learning, certain days in-person learning, lunch in the classroom, change in transportation and bus routine, and no assemblies. Guidelines will be in place in schools for social distancing, frequent hand washing, and disinfecting of surfaces by staff. Extracurricular activities may be suspended or limited to allow for cleaning purposes. Michigan guidance for schools to reopen states that facial coverings must always be worn by students during transportation, in hallways, and in common areas in the building, except for during meals. Any student that is unable to medically tolerate a face covering or is incapacitated or unable to remove the face covering without assistance must not wear one. Is your child able to wear a face covering during the school day? If not, discuss this with school personnel. Teach and reinforce hand washing and/or the safe use of hand sanitizer at home. Teach cough and nose blowing etiquette. It is up to each district to determine how to implement the protocols in their schools. Parents have so many questions and so many things to consider as school gets ready to start in the fall. Think about your child's needs. Think about your concerns and questions. Put your questions and concerns in writing. You may need to ask more than one person to get your concern addressed and your question answered. Will your child have difficulty wearing a face covering all day? Will your child need assistance with hand washing? Will someone else be using a tissue to wipe your child's nose? Will your child need assistance to understand how far to stand from others? Start discussions early about who will provide help for your child if he or she needs it. Be patient with yourself and the school personnel. The situation we are in is new to everyone. Be aware and understand what your district's plans are to help ensure that students are following practices to reduce the spread of COVID-19. Ask how you will be notified if someone tests positive in the school or in your child's classroom. Know the procedure and how the school will handle this. Ask lots of questions. If the teacher doesn't have an answer to your question, ask an administrator. Ask for responses to your questions in a timely manner so you can make decisions and have enough time to prepare. There are lots of questions and not many answers because everything is so uncertain right now. Keep the lines of communication open, and again, share your concerns. Develop a plan with the IEP team before school begins that addresses concerns you may have for your child regarding his or her learning, physical, mental, and emotional health. Discuss the plan and get input from your child if possible. Anticipate behavior changes in your child. Watch for excessive worrying or crying, sadness, or difficulty sleeping or concentrating. These may be signs that your child is struggling with stress and anxiety. It will be helpful to have your concerns documented as you look at all of your options and make decisions that are best for your child and your family. Districts have started to release their plans for returning to school in the fall. Review the information and discuss options with the school team and your child. What are the options for school? Will it be all day in person or some virtual and some in person? What is the plan for virtual learning at your child's school? How did your child do during distance learning? Think about what worked and what didn't work for your child. What is the best schedule for your child? For example, if Mondays are always hard for your child after the weekend, or afternoon instruction has been difficult, discuss this with the team. Develop a plan to address these issues. Help your child develop new daily routines before and after school for returning to school in person. For example, what to pack in the morning before leaving for school. Items such as hand sanitizer, water bottle, and backup face covering. What to do when returning home from school. Washing hands immediately and knowing where to put their worn face covering. Talk with your child about what he or she needs to feel safe and comfortable at school. Use clear language and visual supports with words or pictures to let your child know he or she will be safe returning to school. Explain what will be happening at school, the need for good hygiene, wearing a face covering, social distancing, and reinforcing their daily schedule. Talk to your child about not sharing objects with other students, including water bottles, devices, writing instruments, and books. Go over these daily as reminders of the new school routines. Let your child pick out his or her own face covering. If your child is nervous about wearing one, let them practice on a doll or stuffed animal. Show pictures of their friends or other children wearing face coverings. Talk about what riding the bus will look like. Is there a new way of loading the bus? Less children on the bus? Children not sitting near each other? Talk about lunchtime. How will that work? What will passing time look like for older children? What about using lockers, which usually have a bunch of children near them? What about specials, gym, art, and music? What about field trips? If there will be field trips, what will those look like? What about community-based instruction and work experiences for young adults? What will these look like in person? Consider implementing a home-to-school communication log so that information can be shared between you and your school and is in one place.
Michelle?
Yes.
We have a couple questions if you're willing to take a question or two now.
Sure.
Okay. One is for school districts that have opted to start with remote learning. Are they able to use the contingency plans that were in place this past spring, or are they required to create new plans?
They can use those contingency learning plans, but they should be reviewed to address any new needs that may have come up. So a new contingency plan, might need to be revised, but they should definitely review it and consider any new needs or concerns or issues that have come up.
One other question.
Is it okay for them to review it at just the school, or do they have to involve the parents in the review?
They should involve the parent in that, but the schools are able to develop those plans, but they are encouraged to involve the parent in talking about the concerns and the services and how those services will be provided.
There's one other question. Andrea says she has a lot of questions about virtual learning and students needing or needing to have one-on-one written into the IEP to help with redirection, behavioral issues, modifications of assignments, etc. Is there guidance on how this will be addressed with learning only happening online in the home?
That it is up to each specific district and each individual IEP team to take a look at those. There's not a clear one answer about how all that will work. So, so it should be discussed, again, involving the parent. The district can develop a plan, but they're encouraged to involve the parent in that, and especially to address any new concerns or issues that have come up, especially during distance learning last school year, what worked, what didn't work. So you should take a look at all of that and figure out what other supports and services need to be in place, and then how those would be provided virtually. So FAPE through distance learning can look different than FAPE in brick and mortar building.
Thanks, Michelle. That was all the questions for right now.
Thank you. Something else to take a look at is that school may look different for your child than for his or her friends. I know kids are anxious to get back to school with their friends, but how does your child feel about that? If some of their friends may be going to school in person and some may not. So talk with your child about the possibility that he or she may not see friends in school, that friends might have different schedules if school is in person and virtual. And talk about how school will look different for all children. Desks will be far apart from each other. Teachers are maintaining physical distance. Lunch may be in the classroom. Teachers are disinfecting surfaces and students are washing their hands often. Does your child know relaxing and calming strategies to use if he or she feels upset? This may be a good time to learn or practice these strategies. Add this practice into your child's daily routine at home and at school. Does your child need to bring something of comfort to have on the school bus? An activity to keep them busy during the bus ride to help with anxiety? Pack these items in their backpack to have at hand if needed. Can your child meet his or her new teacher virtually or with social distancing and see his or her classroom or school building before school reopens? Meeting the new teacher and seeing a new classroom or school building may help ease some anxiety. Does your child know who he or she can talk to at school if they're scared or feeling anxious? Who will be that go-to person? If not, talk about this with the school team and determine who your child can go to if he or she needs help or has questions. Help your child build confidence to advocate for what he or she needs to feel safe and comfortable at school. Encourage your child to talk with you and share their concerns about the new routines at school. Check in with your child frequently to see how things are going. Watch for signs that your child is dealing with stress and anxiety, and quickly address any issues and concerns with your child's teachers and IEP team. Keep communication open and ongoing. Share information with the IEP team about conversations you and your child had during distance learning, as well as information about what services were provided and what services were not provided during the school closure. In the new school year, how will services be provided, such as speech and language, occupational therapy, or social work services? If your child needs additional adult support, for example, a paraprofessional, how will that look? Share data that you have collected regarding your child's progress towards his or her IEP goals. Review the progress on IEP goals from the last source of data before schools closed for the school year and compare this to his or her current level of performance determined by the district. What worked and what didn't work during distance learning? If your child will be doing some virtual and some in-person learning this year, environments. Review the provision of FAPE during the period of distance learning. Some specially designed instruction, supplementary aids and supports, and related services may not have been provided during the school closure and may have resulted in a regression of skills or affected your child's ability to make progress in the general curriculum. Discuss the regression of skills during the school closure and the impact on your child's progress on his or her goals. This information will be considered when looking at whether recovery services are warranted. And we will talk about what recovery services are. That's a new term for us. Do you need to meet with the team to discuss changes? When will the IEP be updated to reflect new needs? Keep asking questions. Know your rights. Your school must give you written notice, provide you certain information in writing, whenever it proposes to initiate or to change the identification, evaluation, or educational placement of your child, or the provision of FAPE for your child, or the school refuses to initiate or to change the identification, evaluation, educational placement of your child, or the provision of FAPE to your child. School buildings were closed by executive order as a result of the public health emergency. Instruction was interrupted and the closures led to foregone learning for all students. Foregone learning is a new term specifically related to learning that could have occurred in the absence of the COVID-19 pandemic. Recovery services is also a new term. These are services that are supplemental to the offer of FAPE in response to and school building closures and the additional impact of the loss for students with IEPs. Recovery services must align with the IEP. They may not necessarily replicate services currently in the IEP, including the frequency, duration, and type of service. They are an effort to support the student in making progress in the general education curriculum without further delay. They must supplement, not supplant, the services provided as part of the current offer of FAPE. They are intended to support the achievement of the annual goal and can be provided within the course of the typical school day. There is no entitlement or requirement for districts to provide recovery services. Decisions about whether recovery services are made available is district-wide. The district will either make recovery services available or will not. While the Michigan Department of Education encourages districts to consider making recovery services available, recovery services are not automatically warranted because a student failed to receive any services stated in the student's IEP as a result of the school closures. Whether recovery services are warranted is individual to each student with an IEP. You should work with your child's IEP team to determine the impact of any foregone learning while schools were closed for in-person instruction. If you disagree with the district's decision regarding whether and to what extent recovery services are warranted, there is no legal remedy. If recovery services cannot be agreed upon, or if you believe there was a denial of FAPE, due process provisions under the Individuals with Disabilities Education Act or Michigan Administrative Rules for Special Education are available, and we will talk more about this. If recovery services are warranted and the district agrees to provide those services, they must be documented in the IEP. If the recovery services are in the IEP and the district fails to provide them, then it is a failure to implement the IEP. This chart compares compensatory education and recovery services due to the COVID-19 pandemic and provides information about extended school year. Compensatory education results from a state complaint or a due process hearing or focused monitoring corrective action for a district identified non-compliance leading to an educational loss and a denial of FAPE. It's a remedy to place children in the position they would have been in if it wasn't for the violation. Compensatory education services must be provided outside. Services are based on individual needs of the student and should align with the IEP goals and objectives as determined by the district with input from parents as directed by the Michigan Department of Education, Office of Special Education, or the administrative law judge. The type, amount, frequency, and duration of compensatory education services is determined by the Michigan Department of Education, Office of Special Education, or the administrative law judge. It's important to remember that just because a service wasn't provided or the district failed to do something doesn't mean that compensatory education is due. There must be an educational loss and a denial of FAPE. Recovery services result from a loss of instructional time due to the COVID-19 pandemic, an additional impact of instructional loss for an individual student with an IEP. They provide additional support to assist the student in meeting IEP goals, as well as making progress in the general curriculum. Recovery services can be provided within the normal school day. They are based on the individual needs of the student and should align with the IEP goals and objectives as determined by the IEP team, including the parent. The type, amount, frequency, and duration of recovery services are determined by the IEP team, including the parent, and is based on student-level data. Decisions regarding recovery services due to COVID-19 must be made during the first 6 months of the 2020-2021 school year, including the summer. Extended school year services is a predictive analysis of how the student fared during past previous periods of breaks in instructional time, such as summer, winter, and spring breaks. Based on these past periods of breaks, extended school year services are determined to be needed or not needed. When IEP teams are discussing recovery services, they must consider the actual impact of the extended school closures on the student's ability to retain skills and make progress on their IEP goals. Students may be eligible for extended school year services, but might also warrant recovery services. If you disagree with supports or services in your child's IEP, you have several options to resolve the issue. You should start with informal strategies such as meeting with the team and reviewing the IEP. If the issue is not resolved, consider a facilitated meeting. A neutral person facilitates the IEP meeting, helps keep the discussion focused on the child, and ensures everyone gets to talk. A facilitator can help address and diffuse conflict between the parties. A mediator is neutral and has no connection to the parent or the district. The trained mediator helps parents in the district talk about the issues at hand and work towards an agreement. Both parties must agree to mediation. Through mediation, a written agreement is signed if the issue has been resolved and the parties agree on the resolution. The agreement is enforceable in court, which is through a due process hearing. A state complaint is a written complaint that is submitted alleging that the district has violated state or federal rules or regulations. The Michigan Department of Education, Office of Special Education, and the intermediate school district investigate the complaint, interview the complainant and/or the parent, district staff, and other relevant people, and review relevant documents. Issues that can be resolved through a state complaint include alleged violations of the Individuals with Disabilities Act, Michigan Administrative Rules for Special Education, intermediate school district plans, and Michigan laws related to special education. Anyone can file a state complaint, and it must be filed within 1 year of the alleged violation. The Michigan Department of Education, Office of Special Education, issues a written final decision. A due process complaint is filed with the Michigan Department of Education, Office of Special Education, and they refer it to the Michigan Administrative Hearing System. The Michigan Administrative Hearing System appoints an administrative law judge who is an impartial attorney and trained in special education. A resolution meeting is required unless the parent and a district agree to waive it. This is one more chance for the parties to try and resolve the issue at hand. If the issue is still not resolved, there will be a due process hearing. The administrative law judge conducts the hearing similar to a court hearing, can be cross-examined, and parties present documents and exhibits. A decision is made by the administrative law judge and is enforced by the Michigan Department of Education, Office of Special Education. Issues that can be resolved through a due process complaint and hearing are specific to eligibility, identification, placement, FAPE, evaluation, and a manifestation determination review decision. A parent or a student, if 18 years or older, the district, or an attorney for the parent or district may file a due process complaint. It must be filed within 2 years after the alleged violation occurred, and the administrative law judge issues a written final decision and order. As we are wrapping up, consider these questions to determine what your child will need to feel safe and comfortable at school and be successful in the new school year. Do you feel comfortable with the school's reopening plans for reducing risk of spreading COVID-19? Do you feel the school has the resources to effectively implement their reopening plan? Do you feel comfortable with your school's plan if a student or staff member tests positive for COVID-19? Do you feel that your school has a plan to provide an effective program of instruction every day of the regular school week? Are you satisfied with how your school communicates with families about changes it's considering? Are you satisfied with how your school is addressing parents or student concerns and questions? Does your child know how to properly wear a face covering and understand the importance of doing so? Can your child wear a face covering for an extended period of time? Do you have arrangements for your child for transportation to and from school? Are you comfortable with your child taking the bus or with your child being part of a carpool? How comfortable are you with your resources to address your child's learning, physical, emotional, and mental health needs as your child gets ready for school to start? Does your child have new needs that you will share with the IEP team? If so, when will you discuss this with the IEP team, and when will the IEP be revised to address these new needs? When will you have the discussion about whether recovery services are warranted for your child? And what other information do you need to help your child prepare to return to school? So that is the end of the presentation. I've included some resources on these next couple of slides, and I believe these will be available as well as the PowerPoint and a couple handouts for you. And thank you for joining me. I hope this information was helpful. We have a comprehensive website that has usefully, timely, and accurate information, especially our COVID-19 webpage. If you are in need of individual help, Michigan Alliance for Families has parent mentors who live throughout Michigan. You can find the parent mentor that covers where you live by going to our website, michiganallianceforfamilies.org, and look under the About Us tab. Or you can reach them at 800-552-4821. And through the magic of technology that works, you will be sent directly to the parent mentor in your area. Don't forget to stay connected with us on Facebook and Twitter, and check out our on-demand webinars on our YouTube channel. The Michigan Alliance for Families is here to help you with information and individualized assistance to families. Parent mentors around the state are ready to help you. during these uncertain times. Again, thank you for joining me, and I hope that you and your family stays healthy and safe.
Michelle, I have one question for you from Sue.
Sure, and also this is a link to our survey, and I think this was going into the chat box. If you would please assist us by taking a survey about the presentation, and we truly appreciate your feedback. And the question?
Sure. Sue asks, what happens if a student had his annual IEP done in March and the school goes virtual? How would it be determined that recovery services are necessary since the student has never received instruction and still has time to reach the annual goal? I don't know if there is an answer for this, but these are some of the issues coming to me.
So again, it's, it just depends on the individual student needs. And I would suggest that the parent talk about any data that they collected, what happened during distance learning with the services that were provided, the information that the parent has gathered about how the student was able to do the work and work towards their goals and participate in the virtual learning, and bring all of that information to the table. And then you have the conversation about any regression or losses that occurred above and beyond what occurred for all students. And that's where you would take a look at whether those recovery services are warranted. So it really involves that individual conversation as an IEP team.
Thanks, Michelle. I have one more question.
Sure.
Have you heard of any work-based transition programs that are being done remotely that are focusing on individualized work skills per the individual student's IEP? If so, can you share, please?
I do not have any specific information on that. I would, in this particular situation for this person in their district, I would suggest reaching out to the 800 number or our website information and connect to the parent mentor in your area. They can, the parent mentor will then gather some information. The parent mentor may reach out to me for some additional information as well, but that parent mentor can help you investigate what's happening and may possibly know more information down on the ground in your area of what's going on with that.
Great. I have a couple more questions.
Okay.
First, are there no provisions being made for parents who have to work but don't feel safe when sending their children back to school?
I'm not, can we get some clarification? I'm not sure exactly.
I think the question's asking, are there any contingencies that are being put in place for working parents who may not feel comfortable sending their kids back to the classroom that you're aware of?
The only option that I guess I can think out would be to discuss the situation with the IEP team and determine look at updating the contingency learning plan if one was done in the spring. I'm not sure as far as for a student who parent does not want to send the student to school, and the student's going to be doing work virtually, but the parent has to work. I'm not sure how that would be handled. I mean, that would be a situation where the parent would, of course, need some support in the home to be able to help with that. But I think that's a conversation for the IEP team as far as the services go and how that student's IEP would be implemented. But I would also, again, reach out to a parent mentor in your area. They have more on the ground information of what's happening in your area. and they may be able to provide you some additional resources if you have to go back to work and your student's going to be working, doing their work virtually. Sorry, I can't give more information about that.
No, that was good. That was good. Shannon has another question. Has there been any discussion regarding students who were in the ISD classroom for part of the day and in the general ed classroom for part of the day?
I'm not exactly sure, other than just going through the student's IEP and seeing what, will the student be attending school in person? Different areas around the state are doing different things, and that's one of the things that's been challenging is there's not a statewide order of what has to be done. It's up to the individual districts and ISDs to determine that. And so you would have to take a look, and it would be individual based on that student. So again, looking at the student's IEP and talking about how does the current IEP, how will this work when school starts in the fall? And if there's other supports and services that need to be provided, or they need to be provided in a different way, you have to talk about that. Again, I'm sorry, we just, things are so uncertain. I don't really have a lot of specific information.
Great. Janelle has a question. Not sure if you can answer this question. She says, I receive a lot of questions from our ABA providers regarding their services if school is remote. Will they be able to provide services during school hours? Typically, the student would be in school during the day, but if they are attending remotely, there is more daytime hours available.
So again, the only information I can probably offer would be to talk about, talk with the teachers and the IEP team about what the student schedule is going to be. When school was distance learning the spring before schools closed, between the time that schools were open, and they closed, and the end of the school year, students were on all different kinds of schedules. So I am personally not aware of students that were in school at home, virtual school, for 6 hours a day. So there could possibly be some time during the school day to provide those services. I guess it really on what that student's schedule is and how to fit those services into that school day if that's what the student needs.
That's all for questions right now.
Mike, we have a question on Facebook.
Go ahead.
That said, if there are issues getting support for an IEP during remote learning, is there someone we could contact?
If there are issues like with an individual student?
Yes.
Yeah, I would suggest, so I personally would suggest reaching out to the Michigan Alliance for Families parent mentor in the area, so that they can provide some individualized assistance with the family and those involved with the family to figure out how to resolve those issues.
Thank you. And then we had a question that Andrea asked that will probably need much more information, but I want to ask it on the recording just in case other people have this question in there when they're listening to the playback. And it's, I have a school district that is pushing for in-person learning due to a parent survey response and the athletic focused nature of the district. They have contracted out to a virtual university that the school district has openly stated is much less vigorous than what will happen in person, and is pushing for penalties for online, such as not being allowed to participate in athletics, clubs, grade penalties when they switch back to in-person, and with no awards. How can districts have such significantly different educational standards for in-person and virtual?
I am not sure about the answer to that. You know, it's up to districts. It's clear that it's up to districts to develop their plans. The plans have to provide options for all, students with IEPs if they're providing options for all students. I'm not sure about the question about the contracting with another entity and the disparity between those services. I would suggest, again, reaching out to Michigan Alliance for Families. Through the parent mentor, can contact me as well to get some information. And this is something that I would have to do some research on. But I would suggest connecting with Michigan Alliance for Families to start that process and get some information.
Thank you so much, Michelle. I'm going to leave it for a couple more seconds. And while we're waiting to see if anyone else has questions, I would just like to say thank you to Michelle. We wanted to offer this opportunity for people to get information about just what they should be thinking about, as they're preparing, as children are preparing to return to school. It appears that, this is rapidly changing every day. And talked about, the information you gave and the stuff to consider today in a week might not even be relevant anymore. But this is definitely a good start. It's a good place to start when you're thinking about what's going to happen in a couple weeks. September's fastly approaching. And I know that the Alliance, they are there. They are always a good partner with the community. And the Alliance is hosting a webinar series on school reopening. Michelle, do you want to talk a little bit about that? And we will see if any more questions come.
So I don't have all of the details right in front of me, but it's a back to school webinar series. I believe it's 3 days. I know it's in August and I think the beginning of September maybe. And they're going to be talking with families and sharing kind of some similar kinds of things about what to consider when schools are reopening and other back to school in COVID times kinds of issues. So you can find that information. I'm sorry, I don't have all of the dates and times right in front of me, but you can find that information on our website.
Thank you, Michelle.
There are no more questions. Oh, wait, Tedra, we have a late question. Deborah asks, she says, I'm late due to another Zoom meeting. Is there a survey for parents with kids with IEPs? Is there a document that explains how IEPs will be implemented this school year?
So none of the rules or regulations have changed. So you would take a look at talking with the IEP team about concerns and issues that had came up during distance learning. And thank you for putting that up. And discuss specific concerns related to your child. If you want to take a look at the PowerPoint, I know you came in late, but you can take a look at the PowerPoint handout and the handouts, and that will probably give you some good information on where to start those conversations. Also, upcoming, the return to school conversations and strategies for supporting your child's learning at home and returning to school conversations. There's a whole lot of information up on the Michigan Alliance for Families website. So I would suggest also, as you're thinking about the start of the school year and how your child's IEP is going to be implemented, all of the things that we just talked about, what school will look like for your child. Take a look at the Michigan Alliance for Families website. We are putting out a ton of information to help people start thinking about and get more information about the upcoming school year.
And I did put the link to the Michigan Alliance for Families upcoming events in the chat, and we will also post it on Facebook if people would like to register for the upcoming webinar series. On the 13th, which is next Thursday, return to school conversations. The following Thursday, the webinar is on strategies for supporting your child's learning at home. And on the 20th, return to school conversations. 27th, return to school conversations. So they will be really just trying to help people with some positive behavioral supports, since it looks like a lot of us are going to be learning from home, and helping people. As we said, this is a rapidly changing arena. And so the Alliance is really there to support families and help families get through.
Absolutely.
And I believe, Michelle, that is it. We wanted to just make sure that we gave people ample time today to ask questions or comments. What we are going to do is record all of the questions that we got today and send them over to the Michigan Department of Education Office of Special Education, just so that they know what kinds of questions are out there, and it might help them to be able to put out guidance to families or to school districts, that is more responsive to what people's real-time questions are.
Absolutely, absolutely. And Michigan Alliance for Families parent mentors are doing the same thing. We've been talking regularly with staff from the Office of Special Education to get clarification on the guidance that's coming out. So we are trying to get that information out to families in a timely basis. If you do connect with a parent mentor, and that parent mentor needs additional information, they know how to reach me as well. And I provide support to all of the parent mentors and Michigan Alliance for Families staff across the state. So I think between all of us, hopefully we will get some more clarification and get our questions answered.
Well, great. Thank you, Michelle. And thank you everyone for joining us today. This was some really good information. And as we said in the beginning, the recording along with the slides and a couple of other resources will be available on ddi.wayne.edu/MDDC. Thanks so much for joining us today. Everyone have a great rest of your day. Bye.
Thank you.